It's 10:30 at night in a skilled nursing facility anywhere in the United States. One of the residents is having some difficulty breathing, a feeling she's had before. She signals the nurse for help, knowing that this probably means a stressful ambulance trip to the emergency department.
Hi, Mrs. Wilson, your light's on. Can I get you something?
I'm having trouble with my breathing. I can't take a good breath.
Let me take a listen.
This scenario plays out thousands of times each day in skilled nursing facilities. When patients are in distress after hours, it's often impossible for their busy primary care physicians or a covering physician to see them.
I hear a lot of wheezing. I'm going to give you a breathing treatment and call the doctor.
Thank you very much.
Hello, Dr. Stillman? I'm calling about a patient of Dr. Harvey's. Mrs. Wilson?
Often, the only choice is to send them to a local emergency department where they may spend hours waiting to be treated.
Yes, I understand. I'll call the ambulance and send her to the hospital. Thank you.
Now, there's an option. A group of dedicated physicians have combined modern video conferencing technology with good old-fashioned medicine. The result? Phone Doctor.
Hello, Dr. Shea. I'm with Mrs. Wilson. She's having some trouble breathing.
Hello, Mrs. Wilson. I'm covering for Dr. Harvey tonight. Can you tell me what's happening?
I'm having difficult breathing. I can't take a deep breath and I'm very uncomfortable.
Oh, I'm sorry to hear that. Let's see if we can get you feeling better.
At its heart, Phone Doctor is a real-time video conference between a board-certified physician, a nurse, and a patient.
Mary, can we get a pulse ox on Mrs. Wilson?
It's 90.
Yeah, that sounds good.
The doctor assesses the patient's condition. The nurse initiates appropriate treatment.
Mrs. Wilson, I agree with your nurse. I think it's your emphysema that's acting up. We're going to give you an extra breathing treatment and a dose of steroids. I know those have helped you before. We're going to keep a close eye on you tonight, and I'll leave a message for your doctor so we can check on you tomorrow.
Now, patients and nurses have instant access to medical care when patients' primary care physicians aren't readily available.
Yeah, Mary, how long is Mrs. Wilson?
Phone Doctor allows many patients to be safely, effectively managed in their nursing facilities. More seriously ill patients can receive initial treatment while they wait for urgent transfer to the hospital. Phone Doctor does not replace primary care physicians or personal visits. It does replace a diagnosis rendered over the telephone without a physician being able to visualize a patient or consult their records. Phone Doctor can help eliminate unnecessary trips to the ER and help lower the overall cost of health care.
Hello again, Mrs. Wilson. How are you feeling now?
Dr. Shea, I want to tell you that I'm feeling better. I'm breathing much easier and I thank you very much.
Oh, you're welcome. I'm very glad we could help.
Solving today's healthcare problems requires innovation and originality. How to give nursing facility residents timely access to medical advice? Phone Doctor uses a patented process to make modern technology part of the solution. For more information about Phone Doctor, please contact us at 1-866-539-7379 or visit us online at www.phonedoctorx.com.